everyone. It's my pleasure to introduce our FHS seminar today entitled The Corporate Capture of Public Health, the Commercial Determinants. Sorry for being late. We are happy to have the panel of speakers with us today, including Dr. Rima Nakkash from Mason University, Dr. Judy Makhoul, and Dr. Lilian Ghandour from FHS AUB. Dr. Nason Maani from the University of Edinburgh. So in this seminar, our panel will provide an insightful overview of the commercial actors and their multiple influences on people's well-being and their surroundings globally. Dr. Rima Nakkash will start by introducing the global governance, ethics, and conflict of interest in public health network, its mission and objectives, and an invitation to join the network. She will also launch the first online course on commercial determinants of health. Dr. Judy Makhoul will then present an overview of the concept of commercial determinants, why these are problematic, and the strategies of action they use to influence health and living. Following this, Dr. Lilian will highlight the multiple channels in which the alcohol industry interferes and lobbies to increase young people's alcohol consumption through country cases. And finally, Dr. Nason will talk about the factors that make low and middle-income countries vulnerable to the increasing influence of the commercial determinants of health. So this seminar promises to be an eye-opening and thought-provoking discussion of an important topic that affects us all. Thank you for joining us all today, and we hope you enjoyed the seminar. So we will start with Dr. Rima Nakkash with the recorded video she sent us, and then we will move on to Dr. Makhoul.
Good morning, good afternoon. I'm happy to be sharing with you today information about governance, ethics, and conflict of interest in public health network. I'm happy to participate in this FHS seminar and speak to this audience under the title Corporate Capture of Public Health, the Commercial Determinants of Health. I am Rima Nakkash, and on behalf of also the co-coordinator with me of the network, Dr. Mayon, from Trinity College Dublin in Ireland. I would like to talk about this network as I was asked by Dr. Makhoul, and I hope that we get interest in this topic and further growth of our network membership from faculty, students, and beyond in UB and in Lebanon. So this network started basically as a result and was initiated based on identified potential risks of partnership between for-profit corporations and public health academic institutions and researchers, and the lack of clear data on how pervasive these partnerships are, and particularly on the attitudes and behaviors within the public health academic community vis-a-vis such engagement. It started in a project that was funded in the Faculty of Health Sciences by IDRC. And basically, the network is an outcome of work that this project led to. Who's the network? We are a group of individuals and academics composed of members from institutions and civil society organizations who are concerned about private sector influence on public health research, practice, and policy outcomes. We were established in February 2018 following the completion of the project that I just talked about, that was funded by the International Development Research Center and had a follow-up grant, seed money to support the establishment of the network at AUB, to be housed at AUB at the Faculty of Health Sciences. The objectives of the network are to share, collate, promote, and foster knowledge of industry interference in public health research, policy, practice, and education, to document governance, ethical, and conflict of interest issues that arise in the interaction between public health research, practice, and policy and industry involvement, to build capacity, set research priorities, and act as a forum for collaboration between researchers and civil society actors in topics that are relevant to the network, strengthen relationships with advocacy organizations at different levels of governance, advocate for research and action to push and advance for aims and objectives of the network, and promote and foster dialogue around evidence use through knowledge translation, monitoring and evaluation, and building and developing evidence tools around this topic. We have a coordinating committee which meets every 3 months since the inception of the network, and participates in workshops, symposiums, and meetings over the years, usually back-to-back and in conjunction with other events. Those workshops are initiated by various network members, and topics are put together in partnership with network members. And we communicate and disseminate to members through a regular email that goes out every 2 weeks on resources relevant to the network, and we have a Twitter handle and website that I will guide you to in a while. So what does it mean to be a network member? We have access to a global audience. We send news to all our members about conferences, announcements. We share and have been part of letter campaigns that have advocated against industry interference in various topics. We share publications and have on our website a resource that puts together all the literature as the one place that people can go to see literature on the topic. We have a network that enables us and provides a platform for the exchange of ideas and building interactions and strengthening relationships, connecting members together who are interested in this topic, and are available throughout to provide support and feedback to members that in the development of their own projects, while they come together and have an idea, conceptualize an idea for a presentation or a symposium. We use our emails and have used our email platform to call on members to join different networks, different possible symposiums or workshops across different academic conferences. The latest review of current membership is we have 122 members distributed across the different regions. As you can see, membership is open to professionals who are interested in issues related to governance, ethics, and conflict of interest in the field of public health. All requests are reviewed by a membership committee at the end of every month, and we check applicants' eligibility, and their eligibility is cleared by the coordinating committee. There is a form that they need to fill to clear for membership. This is our website, which is housed at AUB under the Faculty of Health Sciences and contains resources, relevant literature, as I spoke about, and news and events, webinars. All the webinars that the network has organized thus far are in our house and are available through the website, which is a rich source of information. And also we provide our newsletters. So far we've had 2, and we're working with colleagues on a 3rd one. We're proud of our most and latest accomplishment, which was a project that lasted 2 years in development, which is a self-paced online course about ethical and conflict of interest interactions between private corporations and public health research practice and policy. This course is based on 8 learning objectives or outcomes, each expected to be met through a series of required readings and videos, and a number of assessed deliverables. It's open for all. It's free. It aims to build capacity, especially for early career researchers, professionals who might not have knowledge on this topic. As I mentioned, it's 10 sessions, and the learning objectives were developed and revised by members and experts on this topic. Learning objectives are specifically, upon completion of the online course, students will be able to define the commercial determinants of health, characterize harmful industries and their products, describe the history of industry interference in public health research, policy, practice, and education, identify the health consequences of industry interference in public health, explain the ethical issues arising from industry interference in public health, including the types of conflicts of interest that might arise, identify governance and other strategies to manage undue influence from industry on public health, commit to critical reflection and analysis of any industry engagement in public health research, policy, practice, or education, advocate for transparency in any industry funding of public health research, practice, or policy. The course is set up on the Moodle platform that AUB is familiar with, or AUB members are familiar with. This is just an example of a module where you can see each session is composed of a number of videos through contributions of network members, readings relevant to the learning outcomes, deliverables in the form of discussion forums, as well as quizzes, completion of the course. Individuals who manage to complete the course will get a certificate from the network. We've had very good feedback so far from people that have registered, completed the course. We open registration to the course at the beginning of every month, and it's advertised on our Twitter account, which is, the Twitter handle is @JessiePH. For any further information about the network or about the course, you can write to me or to Dr. Mayon, and we'll be very happy to answer questions. And I also want to acknowledge a very important member of the network, which is Ms. Abir Halabi, who has been supporting the network since its inception and continues to do that. We would not be able to carry on without her support to this state. Thank you for listening to me, and I hope you enjoy the rest of the meeting, and I hope to see everybody soon. Take care.
Okay, thank you everybody for coming. Thank you, Rima, but she's not here. She sent us a recording, and so my turn now is just going to give you the tip of the iceberg about the commercial determinants of health. I'm new to the field, but because it's so interesting, I've been reading so much, and I've done one research study, and I feel like this is a field that everyone needs to read up on and think more about, because it does interfere and it does intersect with every single research that we are doing. And we will see that in a moment. Thank you. All right. So we'll talk about Ronald McDonald and the Children's Cancer Center during the presentation. And these are just some of the sponsors in the recent Qatar FIFA World Cup that was held in 2022. So we all know that we are affected by the wider circumstances within which we live, we work, and where we grow. So if you are unfortunate enough to be born in Yemen these days and Sudan in these days, you will have less likely a chance for you to grow up and to actually reach your 5th year or even beyond the 1st year of life. So that is unfair, but this relates to the circumstances where people are born in and live. This isn't new. This finding isn't new. We've had a lot of very interesting historical moments where researchers and scientists all over the world have identified aspects in our natural environments that are detrimental to health. And so just recent history, in 1962, Rachel Carson wrote a book about the chemical pesticides that have been used extensively in the United States that have had adverse effects on useful insects in agricultural lands. And she pointed to the role of the industry that has produced these chemicals and the problems that they created. And this book calls for environmental justice, and that was the trigger to environmentalism in the 1960s. We also, there's something wrong with this. Okay. In addition to the pesticides in the natural environment, we also have a lot of effects on the living conditions, from the living conditions such as those in the Palestinian Barajni camp, the jails, working conditions, occupational hazards, and also policies that are there and that may not be taking into consideration vulnerable populations. However, our living conditions also can promote health. So if we have good social networks, if we have natural reserves, if we have health enhancing and inclusive schools, we are promoting health. Our collectivist societies, such as those in Lebanon, enhance health by providing social networks and social support, for example. So all of these are called the social determinants of health, and this is not new, right? So these are the non-medical circumstances within which people are born, continue to live, and are and work. They can promote health and they can be detrimental to health. But they are influenced by things beyond our own control. They are influenced by power structures, by distribution of money, by economic conditions. And these days, of course, the attention is drawn to global determinants of health beyond national determinants. And they are responsible for inequities. And inequities are differences between groups of people that are avoidable and unjust, and that can be remedied. So they are not naturally there by default. World Health Organization drew our attention to the social determinants of health back in 2018 when it established the Commission on the Social Determinants of Health. And WHO talks about these inequities and how they are pressing and coming from the structural level, and talking about the unethical and the unequal distribution of these experiences to people. And this model of social determinants, established or developed in 1991, pictures individuals right at the middle with multi-level determinants, because there are many determinants. This is the socio-ecological model that tells us about the importance of wider determinants on our health beyond the individual. However, this is very much limiting to the cultural, environmental conditions in the country and in the nation. And they include also living conditions, working conditions, societal level, interpersonal, community level conditions. However, the determinants of health do not really speak very much about the commercial determinants of health, which are also coined as, in the literature, corporate determinants, commercial drivers, industrial epidemics, health-harming commodities, etc. And this idea first came out recently in 2013, where the definition of the commercial determinants of health were very much around factors that influence health stemming from the profit motive. And this definition developed to include the private sector, and not just the commodities, but also the strategies and the approaches that are used by the private sector that could harm health. In 2020, this definition also was upgraded to include the norms and the practices that are also being used. So it's very interesting how this notion has been has developed. And so these are just some examples of these industries, the health-harming industries. And these are just some of the harms of these industries at the bottom. So you have the arms industries, the food and beverage industry, the garment manufacturing industry, the gambling industry, very interestingly, the agribusiness, the fossil fuel industry, pharma industry, and the technology industry. The Lancet Commission the Lancet produced a series, a very new one, just recently, 2023. It constitutes of a series of very interesting articles that I have read mostly. And they are very attractive, and they tell us a little bit more about the commercial determinants of health, focusing on the diversity of factors, the pathways of action, what are the health harms, and how we need to go about regulating them. So I strongly recommend this. Even the WHO Director General has a commentary there, talking about the need for us to focus on the commercial determinants of health because of the imbalances of power and the need to have new socioeconomic models for us to improve health all around the world. And he says that in 2024, there will be the first WHO global report on the commercial determinants of health. We're looking forward to that, okay? So then one of the articles in the Lancet provides us with a new definition of the commercial determinants of health. And this brings forward to us the strategies that are sophisticated and integrated to promote the commercial interests versus the health interests. And that is at the expense of public health. So you can read more about that. Anna Gilmore and Lacey Nichols and all of these wonderful researchers, who are, by the way, part of the Jesse Network. This new definition points to the systems, not just one actor or two actor or the industry or the products. And we will see later on this new model also, the new ecological model focuses on the system, which is described as a pathological system, which allows these commercial determinants and these industries to grow and affect health even further. The pathways of action through which they work and drivers of health beyond just the industry, we will see in a moment, but also the issue of making sure that the term equity is there, because there is, according to the authors, there is hope that things will be equitable and better. Jen Lacey Nichols also talks to us about the corporate playbook. So what do the corporates do? In addition to the health harming industries, the processed food, the beverage, the firearms, the weapons, the oils, the gas, the chemicals, they also have around them a number of actors that promote their work and support them in marketing, in lobbying, in advising them on marketing, on tax evasion, etc. And the whole system now also should include, according to Jen, the notion of the privatization of public goods. Not just the industry, not just the tactics, not just their strategies, but the whole new world order, which focuses very much on the privatization of services away from the public stakeholders, which usually are supposed to be the governments. So these industries vary in size and scale, and generally speaking, they can be small and local, and they can also be transnational. So these transnational enterprises are huge. They have manufacturing plants all over the world, and they have main offices in countries of the West generally. They are economic growth drivers. They, of course, provide work opportunities in different countries of the world. Some are really easy to identify, such the health harming alcohol corporations, the tobacco industries, and the weapons, the arms industry. But also some appear to be neutral because they produce both health harming and health supporting, like water and fruits and beverages. And some of them are actually affecting health indirectly through changes in the governance, through influencing research, as we will see in a moment. If you have a look at this slide, it tells you that these are very powerful transnational corporations, that their revenues sometimes exceed GDPs of countries around the world. And this then, based on this new thinking about commercial determinants of health, remember this was the socio-ecological model. It has now expanded to include a whole new sphere that includes the commercial determinants of health, and talks about the business models and their practices, how they interfere in public health and influence policy making, labor and employment practices around the world, financial practices. I will not go into detail, but that article is worth reading because it explains the pathways of actions. And the most important thing is that here in the arrows, you will see that they are able to shape the interest of the commercial elite. They're able to influence a culture, and they have a lot of power to influence governments and decision-making, and even the very regulatory system that's supposed to limit their work. There's a lot of conflict of interest, unfortunately. And the term conflict of interest means that when groups of people or a corporation or institution has an interest, has a mandate, and there are secondary interests that influence their impartiality, then that means there is a problem there. And their work now can be influenced, and whatever they're doing, whether it's research, whether it's practice, whether it's regulation, this can be influenced. Their integrity and objectivity are affected. And if we're not careful with identifying this conflict of interest before it happens, then this has capability of influencing public health policies, institutions, and research. There are many unethical principles because of this conflict of interest that are produced, and you can see manipulation, hiding the truth, coercion, exploitation, violation of workers' rights, in these plans of these transnational corporations, threatening public health and safety, and we will see those in a moment. So I'd like to go very quickly through what is it that the corporate playbook shows us. What are these strategies and tactics? How do they harm health? Not just through the health-harming commodities that they produce, but also through influencing research and policies. For example, there's something called a revolving door. So someone is in the government, but at the same time has a paycheck from an industry. And that means that the policies there are influenced very easily. They can move people's thinking, they can influence culture. And see, for example, here you have Jane Walker. And that calls for equality, you know, and gender equality. And there's a very interesting story behind that. I will not go into that. And here, Hayda Jawna, Hayda Nahna. It's something that people start talking about, right? You know, Hayda Adi, you know, it's sort of like a motto that people, and there has to be a beer in every picnic, etc. So it's, and it's a local, right? Almaza is a local beer, but regardless, we need to think about industries that are also local, that even though they might contribute to economic development of a sector, but they are health harming and they market their practices in ways that attract youth. They operate in low-income countries and they frame problems with a focus on individuals. Did you know that the carbon footprint notion was developed by British Petroleum to focus attention on individual behaviors rather than their practices in health. Also, they manufacture fake science. They produce their own research. They manipulate research. They contribute with counter arguments related to research, and they publish them also in peer review journals as well. They have a problem with whistleblowers, and there has been many examples throughout where scientists and others made sure that their secrets are revealed. They divert attention from the problem and create doubt, such as issues related to creating doubt about tobacco being addictive and not having nicotine in it, etc., etc. How do we know all of this? Well, there are scientists that actually read and study and analyze the tobacco documents or the industry documents, either through the emails, the research that they do, the minutes of the meeting, etc. And they also create credibility by influencing academia. Now, here is the crux of the story. They come to us and say, we would like to partner with you, we'd like to support your research. And if academics or universities are not careful about that, they will definitely have an influence on the methodology, on the results, and different kinds of things related to the research. This is called corporate social responsibility, where they convey themselves as part of the solution, not part of the problem. And they contribute to projects and social development and NGOs. And here, for example, Ronald McDonald visited the Cancer Center, 2014. McDonald's Lebanon contributed to 500 million Lebanese pounds in 2014. Then it was a lot of money then. Right now it's not too much, but then it was important. And we can see here that Ronald McDonald spent a lot of time with the children who were already in the cancer center. And that's a conflict of interest because we know that ultra-processed foods are associated with cancers. They also try to use a harmful Now, ultra processed with food additives, with preservatives, with different chemicals, with food enhancers. Yes. And so they use, the life course approach. So get them while they are young and give them produce loyalty to the brands. This is an example of AUB's Absar, engaging public and private Lebanese schools. Also the Nestle Ajyaluna, Ajyal Salima project started at AUB and spread in different parts of the Arab world. They also associate with UN and the humanitarian sector, and this is also not new. Companies contribute in times where resources are dwindling. And this is, for example, how Lebanon, with its multiple crises, received a lot of funding for its crisis through Pepsi, Coca-Cola, and the Tobacco Corporation supported integration of youth in Greece. And of course, different kinds of sanitizers and goods were given by the tobacco corporations. And of course, the recent earthquake, PepsiCo was the first one there to support, and this isn't new, Yani. And of course, Medco is lighting up Beirut in times of crisis. And given all of this, there are also there are watchdogs and advocacy groups that blow the whistle and do a lot of research. And these are just I'm going to show you just the websites, and I will stop there. So you have the Union of Concerned Scientists, very interesting website, very interesting stuff there. Movendi related to alcohol arms, Corporate Watch, specifically for all kinds of corporations and advocacy group, and Business and Human Rights Resource Center, Havaz, Transnational Institute. So at the end, this is the last slide. Jen, I'm saying Jen because I know her. Lacey Nichols actually talks about public health playbook. What should we do in public health? And there are a number of suggestions. The one that concerns us, I think now, and this is نحن في صدد إعداد أو توسيع, is developing and implementing rigorous conflict of interest safeguards for us to help us sift through and decide whether to partner or whether not to partner and to what degree. Does AUB have some sort of policy like this? I don't know. Maybe it should. I don't know. And we will see. Thank you very much. Lilian, it's your turn now.
Thank you, Judy, for providing me this platform. I was told I should not speak more than 7 minutes. So that's approximately the time probably left. It's okay. So, but again, thank you so much for allowing me to speak about this, because this is something that I've been working on recently more than I used to. And the idea of industry interference when it comes to alcohol consumption, there's a lot to say about this, obviously, more than the allowed time. But let me just tell you that throughout my entire career trajectory, I started looking at alcohol consumption from an individual point of view, looking at factors that are associated with alcohol consumption at the individual level. Speaking of the ecological model that you are all very much aware of, thinking about religiosity, religion, and all of that. But then when you delve into the issue really, really, really well, you realize that really there's there's very little we can do if we don't really understand, investigate, and address the commercial determinants of health, especially when it comes to alcohol consumption, and especially when it comes to the alcohol industry interference. So this is why lately we've been working a lot on advocating for alcohol control policies at the national level, simply because there's very little we can do as public health professionals if we don't push for such policies to be in place. this is not the mahwar of, this is not the gist of today's talk. In the next few minutes, I'm just going to tell you not about how the industry influences alcohol consumption. The examples that I'm going to be giving are more about what the alcohol industry does to interfere with alcohol policy, effective alcohol policy at the level of the government. So this is actually way beyond the status for us right now. Right now, we don't have a national alcohol control policy. There are many different developed countries around the nations around the world that actually have an effective policy in place, and still this is a this is a threat to industry, and they do really all they can do basically to interfere with the proper and effective implementation of such policies in place. And this is what I want to shed light on. Actually, the alcohol industry altogether makes more than the GDP of all countries except 54 nations. So you can imagine how much money making it is. And actually, what I was interested to find out also, that it is so profitable. It's not profitable yet compared to the tobacco industry, which is number 3, but it's much, much more profitable than the sugar sweetened beverages, for example, industry, which is at number 40. Okay, so it's definitely at number 8, quite a profitable industry. So why alcohol? A couple of points. It is a public health, but also now it's a sustainable development issue. So there is a specific SDG 3.5 that tackles alcohol consumption, but also it has been also shown to actually be an impediment or a challenge to the effective to reaching 12 out of the 17 SDGs. So there's a lot of literature, for example, that links alcohol with hunger and poverty. So it's indirectly related to the SDG that is relevant to that. This is number 1. Number 2, there is very strong, irrefutable evidence. Yani the evidence is cross-sectional, cohort, experimental, yani all of the robust epidemiological designs that we know of have been have generated findings that irrefutably show that alcohol is linked to many, many diseases, including cancers that I'm going to talk about in a second. And last but not least, alcohol is not an ordinary commodity. And for this reason, this is the 3rd edition of a very, very important book that has been written by very well-known, let's say, researchers and scientists in the field of alcohol consumption, Sally Caswell, Thomas Babor, and a lot of others. And what it really talks about is not just the effectiveness of the alcohol control policies, but the fact that really there can be no partnership with the alcohol industry, not any kind of partnership beyond what what is allowable. So one of the interesting things about the things that are said in this book is the idea of the upstream sources of damage. Okay, so just let me read this out to you, and then I'll explain what that means. So people are so what Thomas Babor says is that people, and young people particularly, but people in general, are kind of getting pushed into a river, okay, by these upstream sources of alcohol consumption. And when we pull them out at the bottom, downstream, they're really in need of a lot of remediation. And if we could just capture them upstream before getting pushed in, we would be in a better position. So, for example, look at the downstream sort of drivers. So here, for example, if you push people down the river, right, and you pick them up at the end, that's where, for example, treatment and Alcohol Anonymous would be. But if you think about it from the perspective of what works the most, those upstream drivers of alcohol consumption and damage, you would be regulating the physical availability of alcohol, making sure that there is a minimum legal drinking age, making sure that actually there are no alcohol outlets within a specific physical distance, whatever. So pricing and taxation, irrefutable evidence there. So then think about it. Why would then the alcohol industry be okay with having all these downstream drivers working and in place, but be against every single upstream driver of alcohol consumption? So this is why. So when you talk about education and persuasion strategies, no alcohol industry would interfere in that area. But if you think about pricing and taxation, that's what they would feel. And it doesn't take science or much evidence to say that common sense tells you that if you don't want something to actually take place, it is because it would interfere with your vested interest somehow and somewhat. So we could do the analysis ourselves, but as Judy just mentioned, Movement International have done great work when it comes to alcohol. They've analyzed basically everything that the alcohol industry has been doing, and they have highlighted several strategies that I'm going to skip because Judy has already mentioned many of them. They use specific language to reframe the carbon footprint as one of them. Harmful alcohol use is another one that's gotten actually. This was actually a lobby victory. This is why I no longer use that word. It's a lobby victory of big alcohol and the adoption of the WHO. So in the WHO Global Alcohol Strategy, they interfered with what they should call alcohol consumption, and they were okay with harmful alcohol consumption, alcohol misuse, because if you think about it, it gives you that impression that it is the individual's problem and not all of the sort of marketing and persuasion and advertising that they are doing to get the young person to misuse that. So if I say alcohol misuse, it means that there's a normal use or a right use of alcohol consumption. So all of this has actually been pushed for and lobbied for by the alcohol industry. When in parallel, WHO has written in Lancet Public Health recently that there is no safe alcohol, especially if we're talking for young people less than 25, but for all population. This is more of a statement for all the general, because one thing that my mentor once told me, I said, you could have all the risk factors, right, but still not have, for example, a mental health disorder or still not use drugs. Why? He said, Lilian, well, because we as public health professionals think on a population level. We don't think at an individual level. We're not doctors, right? So if I have to think what's best for the population. So what has been shown actually irrefutably as well is that even if most of the population drinks moderately, quote unquote, the impact, for those of you who've taken population attributable risk, the impact on the entire population is big when it comes to alcohol. So actually what has been linked by the global burden of disease to mortality and morbidity has not just been the excessive use of alcohol or the misuse of alcohol, but general total per capita alcohol consumption. So if you have more people drinking, then you have a higher likelihood of crimes and violence and so on and so forth in the community. So as Judy also mentioned, how do we know all this? There are people sitting down and actually analyzing the minutes of meeting for several of these World Trade Organization meetings as well. And they sort of know them. What they do is like a thematic analysis and qualitative research. What are some of the things that are repetitively said by the industry itself? So here, for example, it's very small, actually it's good on your end, but basically they use things like, let's request more evidence. This is, let's say, I don't agree with the evidence that's been generated. Why don't we use education and awareness campaigns? And the reason I wanted to highlight that is because research has shown that this doesn't work. And we all know that educating people about the harms of alcohol or drugs, it doesn't work. You have to make some systematic changes. But this is what they want. They want you to actually do, to use the ineffective strategies. This is a world map of the alcohol industry interference. I have just two more slides. You can see how, and these are just 21 examples, selected examples by Movement International of how the alcohol industry actually has interfered with alcohol policy implementation. So this is not about, a study that has shown that more ads lead to more consumption. This is an example of where the alcohol has lobbied against the effective implementation of it. This was very, most of you may have heard this already, but the MAX study, for example, has been halted. This was a big NIMH study where they found out that a working group of NIH advisors had taken money from the alcohol industry to conduct this trial. So what this means that they've actually interfered with also NIMH, NIAA funding. Here, this is another example. I like sort of, if someone donates 1,000, they support you. If someone donates 100,000, they have bought you, something to think about as academicians. But basically what this also article shows you that the donations are often made right before debates on alcohol taxation and gambling law reforms actually happen. So again, it doesn't take common sense. This is my final example. This is something that I've been working on recently, which is the health warning labels, and looking into, for example, because recently WHO has inserted this as an important and effective policy action Okay, and so let me tell you briefly what happened in Yukon, Canada. This is very, very recent. So in Yukon, Canada, for example, they've had warning labels on their alcohol beverages that simply say you shouldn't be drinking when you're pregnant. This has been there since like the early 90s. So what they did is they got funding, Health Canada got funding to actually conduct an experimental study where they put these new labels, colorful, rotating labels on alcohol beverages in one of the government liquor stores in Yukon, Canada. In Whitehorse, Yukon, Canada. And then they left another community as sort of the comparison group. What happened is here is that you can see that the first label tells you that alcohol can cause cancer. And the reason they chose to say that it can cause cancer and not any other health outcome is because very few people know actually the link between alcohol and cancer. Most people think it's tobacco and cancer, but very few people know about this. And there's, again, a lot of evidence that irrefutably suggests that there's a very strong link with many, many different cancers. And this is just a label that basically tells you what a standard drink looks like. And this is a third label that actually tells you, how many drinks to consume per week. Now, funny enough, 1 month into the study, the government gets a call from the alcohol industry in Canada and tells them to pause the study immediately, or they will file a lawsuit against them. Okay, and so the thing is, and the one which one do you think they wanted to cut out from the study? So that they said you can keep these two, but you can remove that one. Okay, because the scientific evidence that you have is weak. You have absolutely no, I mean, the industry is telling the government, this is defamation, alcohol doesn't cause any cancer, et cetera, et cetera, et cetera. So anyway, the government of this very small town obviously feared for its life in the fact that they don't have actually the money for a lawsuit. So they resumed the study a month later, but without this label. Okay, so the study actually continued by just looking at the impact of these two labels without that. Lucky enough, they had already collected data on the first month, obviously, and so they analyzed the data. So they continued to analyze the data, and they actually found out that it actually works. Okay, so the findings, there are like at least 12 articles right now about this, but basically what it showed is that they were able to reduce and to increase the knowledge about alcohol-related cancer risks, but also decrease overall consumption, etc., in just a few months. So again, they wouldn't have interfered if it didn't work. And this is just one example that I wanted to share with you to show you that, and even though there's by the way, the lawyers interfered, and now there's like a list of counter arguments on how they couldn't have sued. But I mean, the government didn't know any better, right? So they immediately stopped the study because they were scared. But thinking back and retroaction, there is nothing that the industry could have done. It was just basically, a fear tactic that the government bought. I think that's it for me. Thank you so much.
The last intervention is by Dr. Nason Maani, who is the first editor of this wonderful book, The Commercial Determinants of Health, by Oxford University Press. He's going to talk to us about low-income countries and commercial determinants of health. Nason, good to see you.
Hi, can you hear me okay?
Yes.
Oh, thank you so much for inviting me. I appreciate this is run a little late, so I'll try to go super quick. So thank you so much to the other presenters. I really learned a lot from their contributions, and I'm so glad that commercial determinants is gathering steam as an area of focus, particularly in contexts like yours and on issues like these. So I just wanted to share some brief reflections on implications for low-middle income countries, and then hopefully that will lead to some thoughts in your own minds for you to take this forward or think about it further. And I want to focus my reflections around three main points. On the way in which commercial determinants reinforce existing power asymmetries, the way in which commercial actors engage or facilitate neocolonial practices, and what a way forward might look like. So on the first point, on reinforcing power symmetries and the world of the possible, I think it's worth saying that, as has been mentioned, one of the ways in which commercial actors can shape policy, can shape initiatives and their own images is through corporate social responsibility, through donations. And we've seen this recently in a couple of ways. We've seen the way in which commercial actors have engaged or been influencing powerful players in global health. So, for example, the Global Fund receiving money from the alcohol industry, Bill Gates buying a stake in Heineken recently, the WHO Foundation receiving donations from Nestle in spite of its activities to undermine infant breast milk substitute marketing restrictions, and these are quite significant because of the scale of the burden of, for example, non-communicable diseases in low middle income countries generally, and their role as growth markets for such companies. And these are part of wider effects, again, going back to what Judy was talking about, of commercial actors in shaping discourse and prioritization generally. So each sector or group of commercial actors might be advocating for their own interests, but together, their cumulative effects, they have this kind of polluting effect altogether that leads to policy incoherence, for example. So trade policy is often at odds with health policy, and these companies serve to prevent this, by ensuring that, for example, when it comes to patent protections or when it comes to investor-state dispute arrangements, they retain a lot of power in comparison to countries and the health departments of countries. The increasing reliance on commercial actors in the global health space also leads to an undue emphasis on verticality, because donors of that type, they prefer to focus on individual diseases, typically communicable diseases, rather than focus on capacity strengthening more broadly. And that's something that, for example, the Gates Foundation has been criticized for a lot. Also, there's a general emphasis on treatment versus prevention. So the pharmaceutical industry is very involved in shaping global health priorities, and increasingly, as has been written about, for example, in The Lancet by Richard Horton, this has meant an emphasis on treatment and making sure that more and more people in low middle income countries can be recipients of pharmaceutical treatments in relation to, for example, obesity or non-communicable disease, rather than focusing on prevention of illnesses in those contexts, because it simply wouldn't be as profitable. And more broadly, there's a real problem when the focus becomes very narrow on health equity as defined in terms of giving a certain amount of mosquito nets or allowing a certain amount of vaccine doses to be distributed, rather than focusing on equity in the structural forces that generate health, like rather than addressing the fundamental imbalances as power and resources that exist between countries and groups of countries. And this has been highlighted in the recent negotiations on the pandemic treaty, where you have high-income countries where pharmaceutical industry is often based, arguing for a very narrow definition of success in the pandemic treaty, focusing on health security and on disease surveillance, but not addressing wider issues that contributed to the pandemic and vulnerability to the pandemic, like the very strong patent protections, the inability to relax them, or the fact that lots of low middle income countries were already paying a lot of money to service debt to other creditors, and linking debt forgiveness into this kind of treaty has also been a point of contention. So commercial actors, in a way, contribute to this wider inequity, in part because of where their shareholders are based, because of where these companies are based, and where they see markets. And an example would be the WHO COVID Solidarity Fund, which distributed funds to help during the COVID pandemic, particularly in low resource settings. but its supporters included lots of the companies that exacerbate health inequalities globally, and particularly in low-middle-income countries. So thinking about the health effects of British Petroleum, for example, in its extractive practices, or of Mondelez International when it comes to marketing unhealthy foods, or PepsiCo, or Cargill in relation to kind of agrochemical safety. So you have this real tension where global health organizations want to receive this funding, but in doing so, they're potentially restricting their ability to say what's most important or to engage in what's most important, and they're reframing the world of the possible down to this kind of very narrow form of charitable giving, of kind of philanthropo-capitalism, where we have to let these companies make the money and then we have to accept whatever aid they choose to provide us with. On the second point, it's hard to think about concepts like decolonizing global health, which has gathered a lot of steam in recent months and years, without considering the role of the private sector, because powerful commercial actors are very active in exploiting emerging markets for harmful products, and often, in the context of, for example, alcohol in sub-Saharan Africa, and a lot of those profits then ending up back in high-income countries with shareholders based in high-income countries. We see exploitation of natural resources and supply chains, which again, a lot of the value being extracted back to high-income countries, and an exploitation of demand for economic growth in low-resource settings, and using that to have more favorable trade deals or lesser regulation than the same companies would enjoy in for example, Western Europe. So as an example, in the UK, the country where I'm based, paraquat, which is a very harmful pesticide, has been banned here since 2007, but UK companies still export tens of thousands of tons of this pesticide. They make it and they export it to countries like India. And these companies actively lobby governments to prevent it being banned in those other countries. So in a very real sense, companies based in the UK are exporting harm to low middle income countries in exchange for profit. And in some cases, the UK government is actively helping this. The Trade Department is helping this as part of its desire to boost UK GDP. Another example linking back to firearms is the fact that US gun manufacturers are being sued by the government of Mexico because US gun makers have been found to facilitate gun trafficking across the border to help boost their sales, which has enormous implications for cartel violence and for governance in Mexico. Recently, there was a deal signed between ExxonMobil and Guyana to exploit oil fields in Guyana that an international NGO found deprived Guyana of a huge amount of the cut of the wealth that would arise from this oil field because of this third point, that their need for economic growth had been kind of exploited by ExxonMobil, who extracted much more favorable conditions from them over the course of a 25-year lease. And in response, ExxonMobil stated, at the time the contract was negotiated, Guyana was a frontier area given its stage of exploration and development. It cannot be compared with mature hydrocarbon-producing jurisdictions, which have evolved fiscal frameworks that reflect maturity and a lower risk profile. So in a sense, ExxonMobil is saying, we're not paying them as much, in part because they're not a high-income country, because they don't have those kind of frameworks and systems in place. So exploiting inequality to extract a little bit more money at the expense of such a country. So those are just a couple of examples. What are the implications for low-middle income countries when it comes to commercial determinants? But crucially, low-middle income country is such a broad term. It means it encompasses a huge range of states in massively different situations, geographically, economically, socially, culturally, historically. And the only way forward will be led by researchers and advocates with local contextual understanding, with experts in those countries, in those settings. It won't be by people like me. I think it will have to link to wider global equity and health challenges, and consider things like the movement to decolonize, for example, global health, or considering things like global trade negotiations and disputes. And I think it will have to be supported by global allies and networks, because many of the challenges do have commonalities, and because it can be extremely risky and difficult for advocates or researchers in those countries to push back against these kind of forces. So luckily, we now have some engagement from the WHO. We have the GECI network and the free course that they've introduced, which I think is a great resource. And we have the launch of the Lancet series on the commercial determinants of health, including there was a regional launch in sub-Saharan Africa with regional experts. And these are hopefully convening points for experts from low-middle income countries to start coming together and deciding on priorities for action. So I'll leave it there. Thank you so much to my colleagues for their involvement in some of this work. Thanks to the organizers and to you for listening. And if you want to find out more, as Judy mentioned, we have this book, The Commercial Determinants of Health, and I also have a podcast which is free to listen to, where we cover some of these topics in a bit more depth. Thank you.
Great. Thank you, Dr. Nason. We are very short on time, so we will end here. If you have any questions, please contact our speakers. They will be more than happy to answer your questions. Thank you all for joining, and see you next time.